Hello everyone, welcome to my channel. In this video I'm going to talk about marasmus. What is marasmus? If you are new to this kind of term, you can be taking it as an weight loss. Okay, weight loss not in an one part of our body, means weight loss happens in upper body or lower body, or only legs and only hands or only face. The body is very kind of big like that. And why we call this marasmus is that the patient will be eating so well, but they will be unable to gain the weight. That time you can think of this remedy. Okay, marasmus is a general weight loss or muscle gain, especially in young children, primarily due to prolonged dietary deficiency of protein and calciums. Myself, Dr. Megha from Homeopathy Clinic. I'm a practitioner of homeopathy from 5 years. A protein. General marasmus means all over the body there is a weight loss. Legs mostly wasted from below upwards. Hepatite is good. Ill effects of suppressed disease. Arsenic alb. Emaciation due to fever. Aurum emaciation after syphilis. Briarta carp. Child is weak and sluggish with tonsillitis and abdomen is very large. Calcarea carp. Emaciation of the skin with large abdomen. Skin is folded, bones do not grow rapidly and normally. Calcarea fos. A good tonic during the disease. Skin is dry, wrinkled and whitened. Can be given an alteration with the indicated remedy. Child face is wrinkled, sweating of head and hands while sleeping. Causticum. Emaciation due to long-standing worries as due to of disease. Actually, you can give Calcarea fos in a patient who is having abdomen very large and hands and legs are little bit kind of weak, and it is also a very good tonic for the people who are not eating well or not hungry or they cannot really digest well like that. Okay, and they will be always having this skin very much dryness of the skin and always wrinkles. Even if you see the children's also, you will feel like why this person is looking like, if he is only 10 years old he will be looking like 15 years like that. So like that kind of thing, the wrinkles will be for the children's also. Okay, you can give that Calcarea fos. If you ask the wrinkles are treated, yes, of course, when the skin is being nourished and when it is hydrated well and the collagen development and the melanin development is fine, of course the wrinkles and the whitening happens. And child's face is always wrinkled, that time also you can think of Calcarea fos, and sweating of head and ants while sleeping. Ferrum fos, Calcarea fos and Natramure. These are all biochemic remedy. You can give it whenever you want, but in the morning and night, 2 pills or 1 pill just with the constitutional remedy. If you are giving the constitutional remedy like Calcarea fos, there is no need of giving Calcarea fos 6x again. Okay, if you are giving Calcarea fos 30 form or 200 form, then you can give Ferrum fos as a combination, or you can give Natramure as a combination. Okay, any combination you can give. You can give thrice daily, means morning, afternoon, night, or twice also, or one time it's also fine. 2 tablets of each, and all the 3 mixed 1 dose should be given early in the morning along with other indicated remedy at an interval of 3 hours. Means Ferrum fos, Calcarea fos, Natramure, one tablet. Okay, You give it in the morning, night and afternoon. Okay, after that you can give the constitutional remedy also if the emaciation is more. Next one is arthritis, emaciation after the meals. Iodine, rapid emaciation despite a good appetite, eats well and still emaciates. Glandular atrophy, wants cool surroundings, fear of people. It may be noted that this remedy in lower potency reduces the weight, and in higher potency, like 1 m and everything, increases the weight. Whenever this remedy in the lower potency reduces the weight, and in higher potency, it increases the weight. There is extreme hunger and the child eats well and more, yet he emaciates rapidly. The skin appears yellow and there is a trouble with the thyroid gland. Natrium, chilliness with pale complexion and constipation. Emaciation starts from above neck or upper limb and spreads downwards. You understood, right? In natrium, from the neck, the weakness means the patient looks very weak. Okay, first in the upper body, then it goes to the lower body. That's all. But in iodine, it goes with abdomen will be large, but the face, hands and the legs will be very much kind of lean, thin, like that. Natrium phos, marasmus of children who are fed on artificial food. Okay, like always eating outside foods or not eating the homemade food, or they are into the junk foods, like that. Next one is phosphorus, emaciation of the menstrual disturbance or menstrual disorders. And you can give it in a young people also, in the adults also, any person you can give it. Next one is Picricum acidum. Emaciation through the appetite is very good. Even the appetite is good, the patient always feels like emaciated. Emaciation due to anemia. Okay. Next one is Cephalinum. A dose can be given after tuberculum. It follows its advantageously, but it should be given only if there is a history of syphilis in the family. Extreme emaciation of the skin. Tuberculum. Treatment should be started with this remedy, and no other remedy should be given for the next 24 hours. If your child or you are suffering with the emaciation, then you can really think of these remedies. If you ask, my child is really kind of eating well, but he is not gaining weight, doctor, can you prescribe any other remedies which are really helpful in the homeopathic medications? Like, I want my child to gain the muscles or the weight, because they will be eating like normal children's only, but normal children's will be gaining weight, but this person will be not able to. That time you can think of iodine, or you can also think of calcarea phos or natrium phos or natrium mure, you can think of. Actually, I give the patient who looks really kind of, means I can know from the exaggeration of the parents, but that the child is eating well but not getting the weight. Their hands, legs, everything will be so lean, thin, like that. First thing is that you should increase their protein intake, you should increase their fiber intake, you should also increase their probiotic. Then you can go with the calcium. Okay, if you ask what are the foods, doctor, which will really help them to go with all this kinds of thing, then go with ragi malt. Okay, it has calcium, iron, everything. Okay, if not, also go with millets or you can go with dry fruits, or you can also go with fruits, vitamin C rich fruits. And you can also go with curd rice, because curd rice is a must and foremost for the children's, because the probiotics are more. Okay, because of that. Myself, Dr. Megha from Homeopathic Clinic. I'm a practitioner of homeopathy from 5 years. If you have any kind of doubts about any kind of thing, just kind of comment on the comment section. If you want to know homeopathic treatment in different diseases or different things which you are really interested for, where you will be having a confusion that does really homeopathy can cure this disease, like that, you can also ask me the such questions. Thank you so much for watching. Please do like and subscribe and share this video for the needy one, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. Thank you so much. Have a good life and a fantastic life.